Most people, if you ask them to confirm, would agree that health is in fact one of the most important things in their lives, perhaps the most important. And by now, many of you would already know that maintaining a good lifestyle, eating well, and exercising regularly is crucial for being healthy. In fact, preventing yourself from getting health problems, doctors say, is much better than trying to treat them.
Definitely. Prevention is always better than cure. So that has been the suggestion by doctors. And of course, all these lifestyle changes that we do talk about is towards preventing any serious ailment.
That's the Indian Express's Anonna Dutt, who covers health for the paper. And she tells us that besides our lifestyle, another key aspect of what they call preventative health is regularly going to the doctor, which for a lot of people can be a fairly anxious experience.
Yes, a lot of people might hesitate to go to a doctor. In fact, most people tend to go to a doctor only when they have some health problem or something that's bothering them. So routinely going for a health checkup is not something that a lot of people do. However, what doctors tell me is that there is an increasing trend, especially after the pandemic. People have become more serious about remaining healthy rather than, going to the doctor when they have any ailment or any problem. So more and more people are getting preventative health checkups and going to doctors for a visit without any condition.
And Anonna, apart from the fact that you can probably catch something in time, one would imagine that it probably also saves a lot of money, right?
It does, yes. So I will take the example of, say, cancer. You detect it early, treatment would be much easier. You wouldn't need, second-line therapies and difficult surgeries. So the cost of treatment goes down. I took cancer because that's like quite an extreme example, but that's true of most conditions. Even for, say, diabetes, you would require lower dose of medicines. You can start your lifestyle intervention quick enough. And in fact, in some people who are early on or people who are pre-diabetic, it can actually reverse. So detecting early, of course, makes you healthy, yes, but also brings down your cost of treatment and cost of disease that you would experience through the life.
So listeners, in this episode, we are taking a break from our usual programming to bring you a complete guide on what to keep in mind when going for a health checkup, based on your age, sex, and lifestyle. Hi, I'm Shashank Bhargava, and you're listening to Three Things, the Indian Express news show. So Anonna, when we talk about regular health checkups, at what age do doctors recommend you start doing them?
So typically, doctors would say that at around the age of 30 years, you start getting certain screening done. But more and more over the last decade or so, doctors are now noticing a lot of heart attacks and stuff in young men. So even at the age of about 25 or so, people are experiencing heart attacks, which means they also are likely to have other conditions that lead to heart attacks, like hypertension or diabetes. All these diseases are happening at a younger age now, which is why doctors suggest, at least for men, that you start getting screened at about 25, you start doing it. Women can delay it a little bit more, but at around the age of 30, I think people should start getting their regular health checkups done.
And should people have a goal in mind, while getting a health checkup? Is there an end goal, so to say?
So there is no end goal per se. It doesn't have to be that, we have to have a certain number on a test. That is not the goal. The goal is that you keep a record of how your health has been for years together. So in case when you have a condition, your doctor knows exactly what has been going on in your body. And also it's a way to sort of keep yourself in check. You would know that, okay, my sugar is going up. So then you would take steps accordingly and you would intervene early. So it's also like keeping in mind what is going on. But no, there shouldn't be a end goal that, okay, all my numbers have to be perfect. This is not a report card.
Okay. So if you're a man, you start at 25. If you're a woman, you start at 30. So what should a typical health checkup for these ages look like?
So there are 3 key tests that you have to get. One is, of course, checking your blood pressure. The second is checking your blood glucose levels, and you can do an HbA1c to see how they have been over, say, a 3-month period. Then the other thing is checking your cholesterol levels. So these three, because these are risk factors for several other diseases. It can lead to a heart attack. It can lead to long-term chronic heart diseases. It can lead to a stroke. So it's risk factor for a host of diseases. So these three are the key tests that you should get, and that would keep you informed about how your whole system is doing.
Also, when we talk about these three tests, what kind of importance do they have in the Indian context?
These tests are extremely important, especially in India. Like I mentioned, we get heart attacks and hypertension as well. We get it a decade younger than our Western counterparts. So, we would see people very young at, 25 getting heart attacks. And if you get a heart attack at 25, you are much more likely to die than if you get a heart attack at, say, 50. And there's science behind it. That's because by 50, you develop these, different blood vessels in your heart that could carry the blood even if there is a blockage in one particular vessel.
And this is something that seems so counterintuitive because, one would imagine that if you're older, you're more at risk. And if you're young, you should be able to take it.
Yes. And which is why we need to say that, it is essential that you get your checkups done even when you're young, because if you get a heart attack at a young age, you're much more likely to die. So it is counterintuitive, but at an older age, you do have these other blood vessels that can save your heart muscles, even if one of them gets blocked, which you do not have as a younger person. So, if one vessel gets blocked, it's blocked and your heart muscle dies. So you're much more likely to die in such a heart attack.
Okay, so we've got our blood glucose levels, we've got our blood pressure, we've got our cholesterol. What other things should one be looking at?
Other than that, the doctors recommend that you could get all your the basic blood tests, which if you go to any of the testing centers or hospitals, they have a list of tests that you can get in a single blood draw.
And is that CBC basically?
CBC, you can also do like KFT, LFT to know how your liver is functioning. So all of these tests are not as necessary as I mentioned, the three key tests, but these are something that you can do to, again, keep a track of how your organ systems are behaving. And in case you have a problem later on, then these can be referred to.
And we shouldn't stereotype young people, but a lot of young people do develop certain bad habits. I mean, there is eating poorly, but also smoking and drinking can start at an early age. Is there any particular thing that especially those who smoke and drink should keep in mind while getting these tests?
So the LFT, for example, would tell you how your liver is doing based on how much you are drinking. And one of the, again, big problems that we are seeing in India, again, a decade earlier than the Western counterparts, is the non-alcoholic fatty liver disease, which is essentially you getting fat around your liver, but that's not happening because of your drinking habit. And then there is, of course, alcoholic fatty liver disease where you get the fat because of drinking. Now, people might think, okay, it's just fat. Why is it important? It's because that fat actually leads to a lot of inflammation in the liver. And so it becomes scarred. And once it's scarred, it doesn't do its function properly, which means you start losing bits of your liver and you would end up in a bad state and could even require a transplant. And also, if your liver gets injured, you're much more likely to get then liver cancer.
And right now, we're basically talking about both men and women. But are there any specific things that young women should include as part of their health checkups?
Definitely. So now, of course, there's a lot of talk about HPV vaccination. But when I was growing up, it wasn't as common. I do not have a HPV vaccination done. So for women who haven't been vaccinated, it is very important that they get a pap smear test done. This will detect any precancerous lesions that they might have, and it has been shown to reduce the mortality due to cervical cancer. And cervical cancer is very common. So it's the second most common cancer among women in India.
And again, something related to young people. Those who are sexually active, especially those who might have had multiple partners, anything they should look out for?
I mean, getting tested for sexually transmitted diseases is very important. And of course, being safe while doing any activity. So they have to take protective measures. Other than that, of course, there's a panel that you would get at any of the testing centers. They would offer an STD panel. That's good enough if you get it done. I mean, depending on how sexually active you are. But I guess once a year should be good for that too.
And what about the other checkups we are talking about? Are we basically looking at getting them done annually?
Yes. So people have different recommendations for different conditions. So let's start again with cancer. If you have a family history of different cancers, then you would require more frequent checkups than somebody who doesn't. So say if you get mammography is usually recommended at the age of 40 to about 69. You would do an annual checkup if you are at risk of getting breast cancer. But if you don't have family history, etc., so you can do that at about, say, 2 years or 5 years gap, you can do that. So then there's cervical cancer. So for cervical cancer, pap smear tests that is recommended, say, about once in 3 years. And that again, you have to keep doing till about the age of 50 or 60 years, which is when you have the highest risk of getting cervical cancer. And the rest of the tests, of course, that would be good if you do it annually.
Okay, so right now we are talking about people between the ages of 25 and 30, 35 maybe. But when do things change? What is the next age group we should be looking at when other tests are also required?
So, like I mentioned, 3 key tests as soon as you're like, say, 25 to 30-year-old. 45 is when you would start being more serious about it. You would start getting the other tests a little bit. You have to add on those tests if you haven't been doing it. And then at about that age, you would also start looking for, say, prostate cancer in men. 50 is usually when you would say 50 plus, you would do prostate cancer tests.
And this age group, 40 to 50, I suppose that's when you're also at the highest risk for kidney diseases, diabetes, heart diseases.
So this is the age where you would see these diseases the most, but the damage happens much earlier. It is when this is the age when it manifests. So if you have kept a tab of your health, you would already know how you are doing. So it won't necessarily drastically change during this age group. But yes, we do see a lot of heart attacks, stroke, a lot of cancers as well happening in this age group.
And what about after 50, when we are talking about, say, 50 to 65, for example?
So, like I mentioned, for men, you have to do prostate cancer screening. For women, you have to start doing heart checkups because once they hit their menopause, their risk of heart attacks is similar to men because estrogen plays a protective role. And till they are menstruating, there's a little bit more protection that they have than men. They can still have heart attacks. It's not that they can't have a heart attack at 30. It's much less likely than a man. But once they hit menopause, that's when the protective effect of the hormones go away. So you are as likely to get heart attacks. So that is something that women have to keep in mind.
And does screening for breast cancer continue at this age?
So for breast cancer, you would screen it till about 69 years of age. Mammography works better when your breast tissues become loose. So you would do it at about, of course, you should start doing it at 40, especially if you are a high-risk patient. But in this age group, you would get better results, and you have to, again, I think doctors recommend that you do it once in 5 years if you're not at high risk, and it should continue in this age group as well. Another very important test that you have to look at during this age group is your bone density test, because a lot of people start suffering from osteoporosis, which is thinning of your bone and which makes you prone to breakages. So if you fall, you can snap your bones pretty easily.
And one thing is that initially it starts out pretty painless, right? So it's tough to even detect.
Yes, it is. You wouldn't realize that you have a problem till a lot of your bone has already been damaged. And once the bone is damaged, it's not growing back. So if you have osteoarthritis, you might need knee implants and stuff later on in life. And of course, you can't completely prevent that, but you can take steps to reduce bone density loss. And that is something that the tests can preempt during this age group.
And now let's talk about senior citizens, those above the age of 65. what are the things that they should keep in mind? Because this is the age group, that is vulnerable to a lot of different diseases.
Yes. So in the elderly, of course, you'll have the risk of all the diseases that we talked about so far. You would have heart attack, strokes. In fact, chronic heart conditions would increase by this age. You would have osteoarthritis that you have to deal with. This is also an age group where you would start seeing a lot of dementia, Alzheimer's. These, again, it's not a very definitive test, right? Like, it has to be detected by family members who recognize that, there's a problem in your cognition, and then they take you to the doctor. So this is something that, geriatric clinics should screen for. And that's why it is important that you're in touch with your doctor through this age group. So you get screened for any cognitive impairment that you have. Again, you get screened for all the bone-related issues, because the risk of falls go up a lot in the elderly. You are faced with muscle loss, so you are losing strength, which will keep you stable. So you're much more likely to fall and also break your bones when you fall. So there's a lot of hip fractures that you see. And, the surprising thing is, if you have a hip fracture, your risk of mortality goes up, surprisingly.
Right, because a lot of people, after they get a hip fracture, they get bedridden.
Yes. So they would remain in bed, and then, of course, that would lead to a lot of conditions. And with elderly people, the problem is they have several conditions together. So managing it becomes difficult. You have to create a perfect balance of the medicines, of the kind of lifestyle that they are following, the kind of food that they are having, and anything changes and it all goes for a toss. So it's very essential that the elderly actually go to geriatric clinics and, keep screening things, keep check on whether all their conditions are managed, whether, the blood glucose levels are in control, whether, cholesterol levels are in control, because it's very easy for everything to go wrong.
Right. And this is also the age when your vision and your hearing deteriorates. And so a lot of geriatric clinics, they also take care of that.
Yes, so geriatric clinics, I will talk about one specifically at the All India Institute of Medical Sciences in Delhi. They have a center for geriatric care, and they do a bunch of tests as soon as anybody comes to them, which would include, looking at whether people are able to balance themselves. And if they have, say, balance issues, that could be loss of muscles, it could be because of your vision, it could be because of your hearing. Because hearing also aids your, how you walk, how you balance yourself. So all of that is screened for as soon as you go into the clinic.
And the other thing to keep in mind about this age group are the vaccinations that they can benefit from, like the flu shot and the shingles vaccine that you recently wrote about, actually.
So again, in the elderly, two things. One is they are at a higher risk of getting the infection and getting a very severe disease when they get an infection. Two, they are already suffering from, like I mentioned, a lot of comorbidities. So again, as we saw with COVID, if you have these comorbidities, you're much more likely to die of an infection. So there is a lot of infections that we see in the elderly and infections that kill them as well. For example, let's take a very simple infection like urinary tract infection. It's a big problem in the elderly. Once they get it, it's extremely difficult to treat. And in fact, people have to get hospitalized to take care of it. So infections are a big challenge.
But UTIs, for example, are very common in younger women as well. But why is it harder to treat them in the elderly?
The antibiotics just don't seem to work as well. And, especially if you are in a hospital, then again, you have the risk of getting other infections while there. So it just becomes very difficult to treat, and the immune system is not the same as it was when you're 30. So all of these things come together to make it very difficult to treat infections in the elderly. And that's why it's better to prevent the infection. And there are several vaccines that are recommended for elderly. One is, of course, the flu shot, which comes every year, and that reduces the risk of the seasonal influenza.
And the risk of hospitalization as well.
Yes. So this is not about preventing. Of course, it is about preventing the infection, but it's mainly about stopping them from getting a severe disease, getting hospitalized, and dying of the condition. So you get influenza vaccine. There's also pneumococcal vaccine that can be given to prevent pneumonia in the elderly. Then there is this shingles vaccine, which has, it has existed before, but recently there was a new vaccine that has entered the market. So now there is more evidence to show that apart from shingles, which is a recurrence of the infection that causes chicken pox. So the second time around, it's a painful rash over one side of your body. Of course, this vaccine prevents that, but also there's now some evidence to show that it reduces the risk of dementia. It protects the heart somewhat. So there was a study from South Korea recently which showed that it protects the heart for up to 8 years after vaccination. So because you're already suffering from a lot of conditions, these vaccines also help in preventing the infection and keeping you healthy from these other conditions as well.
And we were talking about vision in relation to the elderly, but how often should younger people go to an eye doctor?
So that would depend on how good your eye is. Do you have power? Do you have certain conditions? Because some people would have, dry eye is something that's become very common now because of the use of computers and screens, essentially. Then once you get slightly older, you would also have conditions like glaucoma and cataract that would happen. So again, these are conditions which you have to keep an eye on. So it's suggested about once in 2 years, you should definitely go to an eye doctor to get it checked.
And the other thing we haven't talked about is our oral health. Now, there is this old adage that, you should visit the dentist every 6 months. And recently that has been questioned. So how often should one go to the dentist?
Again, that would depend on the condition of your teeth and whether you have certain problems that you're already suffering from. If you have problems, you would have to go more frequently to ensure that there is no deterioration in your condition. But in general, for a healthy individual, you can go like once a year or once in 2 years, and that should be fine.
And we are talking about all these health checkups, and now a lot of places end up recommending these whole body CT scans and MRIs for screening cancer. Should one get those done?
No, not at all. These are highly specialized tests, and you should do it only when your doctor recommends it. And the doctor would recommend if they are suspecting something. Blindly doing a test does not help because it's likely to throw up stuff which may not be important at all, which may not be affecting you at all, but now you know that there is something and you'd be worried about it for no reason. In fact, there has been an ongoing discussion about, whether or not to remove certain tumors or cancers which have been spotted on a PET CT. Now, the problem is that cancer might not, I don't want to say cancer because people get scared whenever we say cancer, but some tumors are actually not growing, and it would take years for it to grow and cause you any problem. And you might just be healthy and you might not need any kind of intervention for those tumors. But now that you've seen it, you can't do anything about it. So that's a challenge. So going in blindly does not help. It should be recommended by your doctor, again, depending on the kind of symptoms you're experiencing and whether that whatever is there in your body is actually causing you any trouble. That's when you get those specialized tests.
But what's the harm if someone does want to get that tumor removed, even if it's not growing? They might not want that thing inside them.
Because any kind of surgery that you do, you're under anesthesia, you would have a cut, you would have to suture that. So that's a trauma for the body. And why do it when you don't need it? And it comes with a lot of risks. No surgery is without its risks. So, you can be that one in like a million complication, and that can happen. So why do it unless it's absolutely necessary?
And Anonna, a lot of people get these home tests done, right? Especially when it comes to blood work. Now, you can receive the reports and usually they provide a healthy range, right? Now, obviously, if something is off, you would go to the doctor. But what if everything is right? Should you still go to the doctor?
Yes, you should definitely go to a doctor. So when I say that you should have a preventative health screening, it's tests plus going to a doctor who would actually look at those tests, who would look at how you're living your life, what all is going on in your life, and make a diagnosis based on that. Yes, you can check your numbers against the parameters given, but they might see something that you cannot because, years of training, they've seen so many cases. So here I would, cite an example of this one doctor told me about a case where a man in his, say, 40s, the only problem in his test parameters was a slightly lower hemoglobin count. And it wasn't too low. It was like 9 or 10, which is within the normal range. But usually men do not have a very low hemoglobin count. And combined with weight loss and other lifestyle changes that he'd seen in that patient, he just asked that patient to get a colonoscopy, and turned out he did have colon cancer. So you will miss that. That's why there's an expert there.
And a couple of tests that we didn't talk about. One is your serum calcium and vitamin D test, iron test, and your thyroid profile. How important are these ones?
So these are some things that you would see in the normal blood panel that you get done. Thyroid test is important again because we have a lot of people who live with hypothyroidism, and that's a problem. You would need medication for that. But usually in that case, you start feeling certain, like you will feel lethargic, you'll start putting on weight. So you do have a trigger to, get tested. Then we talk about serum calcium. That's again something that has to do with your bone health. It would tell you how you're doing there. But one test that you raise, which is very important, is the vitamin D levels, which is low for, I think, almost everybody who gets the test done. I mean, everybody gets a result of low vitamin, and you would be recommended vitamin, you get those shots, or you even get tablets, etc. But there is an ongoing, debate in there because some people say that these levels were decided based on A, not very good data at that point, and B, also most of it was based on, Western populations, not Indian population. We do not know what a good vitamin D level is for Indian population. So there are doctors who would say that there is an impact on, say, your blood glucose levels. There's an impact on your bone health. Vitamin D does a lot of these processes in the body. But there is no consensus on how much is the good amount that you need to keep, these other conditions at bay. So there's that ongoing debate about it. But for now, if it's not harming, I would say it's okay. You can take the vitamin D supplements.
And Anonna, we've been talking about the benefits of getting a health checkup done. But what are its limitations? What are the things that a health checkup can't do for you?
So one of the big questions is that, okay, now you know the numbers, then what? And then what is the same in any case? You have to manage your lifestyle. That's the recommendation after most of these numbers. So your cholesterol level is high, you have to exercise, you have to eat right. Your BP is high, same. You have to reduce your salt intake, perhaps. If your sugar is high, yes, you have to avoid, the sweet foods, certain other fruits, etc., and exercise and, make these lifestyle changes. So yes, most of the time, the intervention remains the same, but it is just a way to keep a check on what is going on in your body, which is why you do these preventive checkups. And of course, to pick up certain things that might be going wrong. But in most cases, it's all right. And that's the limitation. People do not want to get tested because, yes, everything is fine. But it's a record of your health, and it is important to keep checking it for that once that it would not be normal.
You were listening to 3 Things by the Indian Express. Today's show was written and produced by me, Shashank Bhargava, and was edited and mixed by Suresh Pawar. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can tweet us at Express Podcasts and write to us at podcasts@indianexpress.com.